Dr. Michael Ryan once said that all countries need to review their strategies now. A pleasant day to everyone. As of today, it has been more than a year since the pandemic started. The Philippine government have implemented strict regulations to prevent and regress the transmission of the virus. According to DOH, statistics show that there are more than 500,000 total confirmed cases recorded nationwide during the span of the pandemic. Questions spark whether the government effectively responded to the outbreak by providing the best practices despite the challenges. I do believe that the government responses are lackluster. In spite of the responsibilities placed on every individual shoulder, the government is unable to minimize the effects of the pandemic and provide enough support to the Filipinos. Regardless of raising alerts and authorizing the local government to employ DRR and protocols, the said measures are poorly managed and implemented. Health Secretary Maria Vergara also admitted that minimum health standards is lacking, which heightened community transmission. The WHO also recommended an early implementation of quarantine, where studies have shown that it is the most effective measure in reducing virus transmission. Although based on Beltran's article, the Philippine government had underestimated the effects of the virus and decided on their last resort, the lockdown, resulting in a plethora of problems without centralizing public health and safety. The Duterte administration also focused on disciplinary actions rather than medical attention, leading to the involvement of the Philippine Armed Forces. Authorities in charge also manage public places to ensure that proper protocols are followed by everyone. But how can the regulations be authorized if those involved are taking advantage of the situation? Several reports of abuse have been reported nationwide, such as police officers committing homicide, barangay officials illegally distributing and selling quarantine passes, as well as army personnel arresting violators without warning. Exposure is the most critical factor that propels the way forward. Neglecting underlying variables results in the proper handling of the pandemic. Poor health management, late implementation of quarantine, and undisciplined authorities are the determinants for the rising confirmed cases daily. Better management, safer lives. At the end of the day, we should always remember the casualties and mortality rate as a reminder for us to be meticulous and careful when lives are at stake.